Anemia is a condition that occurs when your blood doesn't have enough healthy red blood cells or hemoglobin. Hemoglobin is a main part of red blood cells and binds oxygen. If you have too few or abnormal red blood cells, or your hemoglobin is abnormal or low, the cells in your body won't get enough oxygen. Symptoms of anemia like fatigue occur because organs aren't getting what they need to function properly. Anemia has many causes, including a lack of iron, vitamin B12, folate, and other essential nutrients. Some types of anemia are hereditary and can occur from infancy. It can also be caused by blood loss, chronic diseases, pregnancy, alcoholism, and certain medications. Treatment for anemia varies with the cause and may include dietary supplements, changes in diet, or medical procedures. It's important to diagnose the underlying cause of anemia and address it. Regular checkups and nutritional assessments can help prevent and manage this condition. Anemia is a condition characterized by a deficiency of red blood cells or hemoglobin, leading to reduced oxygen flow to the body's organs. While anemia has many forms, they can be broadly categorized into three main types based on their cause. 1. Iron deficiency anemia, the most common type worldwide. It occurs when the body doesn't have enough iron to produce adequate hemoglobin. Causes include blood loss, a lack of iron in the diet, or an inability to absorb iron. 2. Vitamin deficiency anemia. This type includes pernicious anemia and folate deficiency anemia. Pernicious anemia is caused by a lack of vitamin B12, which is necessary for red blood cell production. Folate deficiency anemia is due to a lack of folate, another critical nutrient for red blood cell creation. 3. Hemolytic anemia. This occurs when red blood cells are destroyed faster than they can be made. Causes include inherited conditions such as sickle cell anemia and thalassemia, autoimmune diseases, and certain medications. Other types include aplastic anemia, a rare condition where the bone marrow doesn't produce enough red blood cells. Anemia of chronic disease, often accompanying chronic conditions like cancer, HIV, AIDS, rheumatoid arthritis, kidney disease, and Crohn's disease. Each type of anemia has unique causes, symptoms, and treatments, making it essential to understand the differences for proper diagnosis and management. Anemia, a common blood disorder, affects millions worldwide. Its causes are varied and often interconnected, leading to a reduction in the number of healthy red blood cells, which are crucial for carrying oxygen to the body's tissues. Here are the primary causes of anemia. 1. Iron deficiency. The most common cause globally, iron deficiency anemia occurs when the body lacks sufficient iron to produce hemoglobin. Causes include inadequate dietary intake, blood loss, or increased iron needs during pregnancy. 2. Vitamin deficiencies, specifically, B12 and folate are essential for red blood cell production. A diet lacking these nutrients, or conditions affecting their absorption, can lead to anemia. 3. Chronic diseases, conditions like kidney disease, cancer, HIV, AIDS, rheumatoid arthritis, and Crohn's disease can interfere with red blood cell production. 4. Genetic conditions, hereditary disorders such as sickle cell anemia and thalassemia, cause the body to produce abnormal forms of hemoglobin or red blood cells, leading to anemia. 5. Hemolysis. Some conditions cause red blood cells to be destroyed faster than they can be made, leading to hemolytic anemia. 6. Bone marrow and stem cell problems. Diseases affecting the bone marrow, where red blood cells are produced, can lead to anemia. Examples include leukemia and myelodysplastic syndromes. Understanding these causes is crucial for diagnosis and treatment, aiming to manage symptoms and address the underlying issues. Anemia is not just a decrease in red blood cells. It's a disruption in the body's oxygen transport system, leading to widespread physiological effects. Let's explore the pathophysiology of anemia and its impact on longevity. 1. Reduced oxygen carrying capacity. Hemoglobin within red blood cells binds to oxygen. Anemia reduces hemoglobin levels, decreasing the blood's capacity to transport oxygen to tissues and organs. 2. Compensatory mechanisms. In response to lower oxygen levels, the body increases heart rate and cardiac output to speed up the delivery of the limited oxygen available. This can lead to palpitations and, over time, heart enlargement. 3. Tissue hypoxia. As tissues receive less oxygen, it affects cellular metabolism. Organs with high oxygen demands, like the brain, heart, and muscles, are particularly vulnerable, leading to symptoms like fatigue, weakness, and in severe cases, organ damage. 4. Increased erythropoiesis. The kidney releases erythropoietin, signaling the bone marrow to increase production of red blood cells. However, without adequate nutrients or in the presence of bone marrow disease, this response may not suffice. 5. Alterations in blood flow. Some forms of anemia, especially those involving abnormal red blood cell shapes, can lead to altered blood flow, contributing to further complications such as pain crises and sickle cell anemia. Understanding the pathophysiology of anemia is crucial for managing the condition effectively, highlighting the importance of addressing the underlying causes and not just the symptoms. Anemia affects millions globally and presents a variety of signs and symptoms that can impact daily life. Here's what to look out for. 1. Fatigue and weakness. The most common symptoms, often due to insufficient oxygen-reaching tissues. 2. Pale or yellowish skin. Reduced hemoglobin can make skin appear less rosy and, in some cases, slightly yellow, a condition known as jaundice. 3. Shortness of breath, even with mild exertion, because the body is working harder to obtain oxygen. 4. Dizziness or lightheadedness, particularly when standing up quickly, stemming from a lack of oxygen to the brain. 5. Cold hands and feet, indicative of the body prioritizing vital organs over extremities in oxygen distribution. 6. Irregular heartbeats, an attempt by the heart to compensate for the reduced oxygen by working harder. 7. Headaches, again, due to less oxygen being available to the brain. These symptoms can vary in severity and may not always be indicative of anemia, but if you're experiencing them, it's important to consult with a healthcare provider for a proper diagnosis and treatment plan. Diagnosing anemia is a crucial step towards treatment and management. It involves evaluating symptoms, medical history, and a series of tests. Here's how anemia is typically diagnosed. 1. Medical and family history. Your doctor will ask about your symptoms, dietary habits, family history of anemia, and any medications you're taking that could affect red blood cell production. 2. Physical examination. A comprehensive exam can reveal signs of anemia, such as paleness of the skin or nail beds, rapid heartbeat, or enlargement of the spleen. 3. Blood tests. The most definitive diagnosis comes from blood tests, including complete blood count (CBC). This test measures the levels of red blood cells, hemoglobin, and hematocrit in your blood, providing essential insights into your condition. Peripheral blood smear. Examining a sample of your blood under a microscope can reveal abnormalities in the size, shape, and color of blood cells. Iron studies. These tests measure iron levels in your blood and your body's capacity to store and transport iron, which can help identify iron deficiency anemia. 4. Additional tests. Depending on the suspected cause of anemia, your doctor might order further tests to determine the underlying condition, such as vitamin B12, and folate tests for pernicious anemia, or a bone marrow biopsy to diagnose aplastic anemia. Understanding the cause of anemia is essential for effective treatment, making these diagnostic steps critical. Anemia, a condition marked by a deficiency of red blood cells or hemoglobin, can lead to various complications if left untreated, impacting the quality of life and potentially leading to severe health issues. Here are some of the major complications associated with anemia. 1. Fatigue and weakness. These are not just symptoms, but can also be debilitating complications, severely impacting daily activities and work performance. 2. Heart problems. Anemia can lead to a rapid or irregular heartbeat arrhythmia, as the heart struggles to pump more blood to compensate for the lack of oxygen in the blood. Over time, this can lead to heart enlargement and heart failure. 3. Pregnancy complications. In pregnant women, severe anemia is linked to preterm delivery, low birth weight, and, in some cases, maternal and fetal mortality. 4. Developmental delays in children. Young children with anemia may experience growth and developmental delays, including social and cognitive development issues. 5. Increased susceptibility to infections. Anemia can weaken the immune system, making the body more susceptible to infections. 6. Complications related to underlying causes. Since anemia can be a symptom of a more serious condition, such as cancer or kidney disease, failing to treat anemia can worsen these underlying conditions. Understanding and treating anemia early can help prevent these complications, emphasizing the importance of regular health checkups and following treatment plans as prescribed by healthcare professionals. Treatment for anemia varies significantly depending on the cause, severity, and any underlying health conditions. Here's how anemia is commonly treated. 1. Iron deficiency anemia. This is treated with iron supplements and dietary changes to increase iron intake. Foods rich in iron include meat, beans, and fortified cereals. 2. Vitamin deficiency anemias. Treatment involves dietary supplements and increasing intake of foods rich in the needed vitamins. For B12 deficiency, injections may be necessary if the body can't absorb it from food. 3. Anemia of chronic disease. Treating the underlying illness can improve the anemia. In some cases, supplements or medications to stimulate red blood cell production may be used. 4. Aplastic anemia. Treatment options include blood transfusions, bone marrow transplants, or medications to stimulate the bone marrow. 5. Hemolytic anemia. Treatment focuses on controlling the destruction of red blood cells, which may involve medications, avoiding suspect medications, or treating an infection. 6. Sickle cell anemia. Treatment includes oxygen therapy, pain relief, and sometimes drugs to reduce pain episodes. Blood transfusions and bone marrow transplants are options in severe cases. Lifestyle changes, such as a healthy diet and avoid substances that can worsen anemia, like alcohol, certain medications, and tobacco, also play a crucial role in treatment and management. It's important to follow a healthcare professional's advice closely and go for regular checkups to manage anemia effectively. Treatment for anemia varies significantly depending on the cause, severity, and any underlying health conditions. Here's how anemia is commonly treated. 1. Iron deficiency anemia. This is treated with iron supplements and dietary changes to increase iron intake. Foods rich in iron include meat, beans, and fortified cereals. 2. Vitamin deficiency anemias. Treatment involves dietary supplements and increasing intake of foods rich in the needed vitamins. For B12 deficiency, injections may be necessary if the body can't absorb it from food. 3. Anemia of chronic disease. Treating the underlying illness can improve the anemia. In some cases, supplements or medications to stimulate red blood cell production may be used. 4. Aplastic anemia. Treatment options include blood transfusions, bone marrow transplants, or medications to stimulate the bone marrow. 5. Hemolytic anemia. Treatment focuses on controlling the destruction of red blood cells, which may involve medications, avoiding suspect medications, or treating an infection. 6. Sickle cell anemia. Treatment includes oxygen therapy, pain relief, and sometimes drugs to reduce pain episodes. Blood transfusions and bone marrow transplants are options in severe cases. Lifestyle changes, such as a healthy diet and avoid substances that can worsen anemia, like alcohol, certain medications, and tobacco, also play a crucial role in treatment and management. It's important to follow a healthcare professional's advice closely and go for regular checkups to manage anemia effectively.